A malignant narcissist is someone who enjoys hurting others by lying, manipulating, and using them to get what they want. Narcissism, a trait known for ages, is now more widely understood due to increased awareness of narcissistic personality disorder in pop culture. This makes people question if they're dealing with someone who's just selfish and power-hungry, or if there's a deeper psychological issue at play. This time we're going to talk about what makes someone a malignant narcissist and how you can spot the signs. We'll also dig into why they behave this way and what can be the cause. Try to give you tips on how to protect yourself from the damage they can cause. What sets someone apart as a malignant narcissist? Well, besides being intensely self-focused and craving constant admiration, these individuals have a darker side to their self-absorption. They're experts at manipulation and don't care who they hurt as long as they get what they want. Now, while there's only one formal diagnosis for narcissism, narcissistic personality disorder, there are different flavors of it. How does malignant narcissism differ from the regular kind of narcissism? The big difference is that while narcissism involves symptoms like grandiosity and a lack of empathy, a malignant narcissist takes it to the next level. They have more severe symptoms and often show signs of other personality disorders. Among the various types, people with malignant narcissism are the most damaging to others. They have the usual narcissistic traits, but they also exhibit antisocial traits and can even be sadistic. They lack empathy, have a weak sense of self, and tend to blame others for their own bad behavior. Some experts even say there's little difference between malignant narcissism and psychopathy. They both involve antisocial behavior and a lack of empathy. Recognizing a malignant narcissist isn't always easy, but there are some common signs to watch out for. They're obsessed with their own success and power, can't handle criticism, and are quick to lash out if they feel slighted. They'll use and manipulate others to get what they want, all while expecting to be treated like royalty. They lack empathy, have an inflated sense of self, and don't feel guilty about hurting others. Plus, they often blame others for their own mistakes and tend to see the world in black and white terms. Malignant narcissists behave the way they do because they have an intense focus on themselves and crave constant admiration. They possess a darker side to their self-absorption, expertly manipulating others to fulfill their desires without concern for the harm caused. This behavior stems from a combination of factors, including childhood experiences, genetics, and potential biological influences. They exhibit traits of narcissistic personality disorder, but often with more severity and co-occurring personality disorders, making them particularly harmful to others. Recognizing them is challenging but crucial, as their lack of empathy, inflated self-importance, and manipulative tactics can inflict significant damage on those around them. As for what causes someone to become a malignant narcissist, that's still a bit of a mystery. Like most mental health disorders, it's probably a combination of factors like childhood experiences and genetics. Abuse, overly indulgent parenting, and unpredictable caregiving can all contribute to the development of narcissistic personality disorder. Having a close relative with the disorder can also increase the risk of developing it yourself. And there might even be some biological factors at play, like differences in brain structure. Now, diagnosing a malignant narcissist isn't straightforward since it's not an official diagnosis. It is more of a quality trait. Mental health experts use the term to describe a combination of traits from antisocial personality disorder, narcissistic personality disorder, and aggression. Antisocial personality disorder involves a disregard for the rights of others, while narcissistic personality disorder includes traits like a grandiose sense of self-importance and a lack of empathy. But here's the thing, not all narcissistic traits indicate a personality disorder. Even if your loved one doesn't meet the criteria for a diagnosis, their narcissistic behaviors can still cause a lot of harm. Treating malignant narcissism isn't easy, especially since people with narcissistic personality disorder often resist therapy and refuse to seek help or admit they are wrong at all. So how do you deal with a malignant narcissist? Well, putting some distance between you and them is a good and simple start. Don't try to change them because chances are they won't or can't change. And if you do need to confront them, try to do it in private to avoid triggering their defensiveness, and please be sure you feel physically safe with that person before doing that. Surround yourself with supportive people and remember that their behavior isn't your fault. Malignant narcissism is not the only known type or quality. Check out the different qualities of narcissism.